It's great to have you here, Dr. Bearman, in beautiful sunny Wellington.
It's fun. It's wonderful to be here. I've found people to be fantastic, and it's great that you're taking the time to meet with me. And I hope I can help educate people a little bit.
So, what's your medical background?
I've been involved in drug abuse treatment and prevention for most of the last 50 years, pretty much as a sideline. It's not my main focus, but I mean, I have a lot of expertise in that area. And so after running the community-oriented practice in Isla Vista, I was the director of health services at San Diego State University, and I was there for 7 years. Then I was the health officer and director of a small county health department in Northern California, Sutter County Health Department. And then I had an opportunity to go back to Santa Barbara, and who wouldn't want to go back to Santa Barbara, to be the medical director and director of the health services department of the oldest county organized Medicaid managed care program in the country. And I did that for about 17 years. And then since 2001, I've been doing pain management and cannabinoid medicine. And then I managed to keep busy doing lots of different things. And I've taught courses on history of drugs, on psychoactive drugs at UCSB, San Diego State, and UCSF Extension. So I think that I have a unique perspective on drug policy and also on clinical application. And I've always been somebody that felt that the healthcare system needed to be reformed. And clearly, I think that our attitudes towards drugs just don't make any sense at all. And the first person who even tangentially suggested to me that cannabis was a medicine was my father. We were talking about alcohol prohibition, and he said, when I was at the University of Minnesota, I was a freshman there in the School of Pharmacy in 1928, one of our assignments was to make tincture of cannabis, and he said, and we had to be very careful because the alcohol was illegal. And so I looked up in his 1927 Remington Textbook of Pharmacy, and there on page 999 and 1000, it told you how to make tincture of cannabis and that it was useful as a painkiller and as a calmative, tranquilizer. And frankly, those are still the two top reasons why cannabinoid medicine specialists recommend that.
In New Zealand, our law commission recommended that we change our drug laws, and that still hasn't happened. Mm-hmm. And the political barrier seems to be that there's a perception that if we make cannabis legal, that there will be more harms associated with its use. What would you say to that?
I would say that's rubbish. I mean, why don't we then not have any therapeutic agent that has side effects not be legal? It depends on how you frame the issue. I mean, are we going to look at the benefits or are we going to look at the side effects? And of course, the basic premise is incorrect. In 1988, after a 2-year rescheduling hearing, the DEAs, the Drug Enforcement Administration, a federal agency, their chief administrative law judge recommended rescheduling cannabis, and in his finding of fact, he said that cannabis was one of the safest therapeutic agents known to man. The AMA testified against the Marijuana Tax Act and said they knew of no dangers from the medical use of cannabis, and that was at a time that cannabis had been in the United States pharmacopoeia since 1854. In the 1920s, American physicians wrote 3 million prescriptions a year that contained cannabis. And it was not something that people broke into drugstores to get. When you prohibit something, that's one of the worst regulatory things that you can do, particularly something that is helpful and useful and that people want. I mean, you're creating a crime where none needs to exist. And you go back to Harry Anslinger, who was a really awful human being. He was a raging racist, but Anslinger, he was sort of your typical bad bureaucrat. I mean, he created a problem where none existed in order to expand his bureaucracy, and everything that he said in testifying before Congress was wrong. And furthermore, in 1948, he said exactly the opposite of what he said in 1937. In 1937, he said, if you smoke marijuana, it can cause you to, just be so abnormal that you would kill your brother. In 1948, he said, if you smoke marijuana, it will make you a passive commie dupe. Pretty much the opposite of being this enraged fighter sort of thing. And Anslinger was vicious. And the interesting thing is if we take a look at American physicians, they were, I think, baffled by Anslinger. There's really nothing to be afraid of. If you listen to the ads, and they go on and on about the kinds of side effects, you just don't have those with cannabis. It may cause you to get a little high, but as Dr. Donald Abrams, who's an oncologist at UC San Francisco, says, in his patient population, a little euphoria isn't a bad thing. Yes, if you take large amounts, or if you're naive, basically if you're using cannabis recreationally, it is possible to have an anxiety attack or to have paranoia. But those are the main things. Yes, you can have some problems from smoking, but the way to avoid that is don't smoke. There was a study done by, several studies done by Dr. Donald Tashkin at UCLA, and he said, yes, it causes increased sputum production, increased cough, and increased bronchial irritation. And then he went on to do another study and prove that not only did smoking cannabis not cause lung cancer, but it actually probably prevented it. And we know from studies done with animal studies and anecdotal reports that cannabis can kill many different types of cancer cells. It's not to say that cannabis doesn't have side effects, it's that they're mild and few and far between. And there's a confusion between a conflation of the recreational use of cannabis with the medical use. With medical use, the idea is to treat the condition, to treat the symptoms with the fewest side effects possible. With the recreational use, the goal is to have an altered state of consciousness. And I do have an occasional patient who complains about euphoria, and we say, okay, well, let's adjust the dose on that, or maybe this isn't for you. It's not like, as a physician, particularly a physician who specializes in cannabinoid medicine, that we're saying, you must take this. No, it's like any other medication. Try it, see whether or not it deals with your symptoms, whether you have any side effects. There's this balance whenever you prescribe a treatment between the therapeutic effect and the side effect, and the same thing is true with cannabis. It's just that there's far fewer side effects with cannabis than with most prescription drugs.
For example, if you have serious pain here, you'll probably be given tramadol or codeine or something even stronger that's
Correct.
Opiate-based, and that can have side effects that obviously you're not meant to.
Right, and one of the things that you mentioned, and I forgot to say, that in doing the cannabinoid medicine, I mostly practiced pain management for about 15 years. And what we've noticed in the States is that there's about a 30 to 50% decrease in the dosage of opiates in states or in places where patients are recommended cannabis. In addition, there was an article in the Journal of the American Medical Association about 2 years ago now that showed that in states where medical marijuana was legal, there'd been a 30% decline in opiate overdose deaths as opposed to states where it remained illegal. So, the benefits of the medicinal use of cannabis are overwhelming and inarguable, and anybody who opposes the use of cannabis as a medicine either is unaware of the science or is unwilling to educate themselves.
And is there any risk of addiction, or is there a similar risk of addiction with cannabis as with opiates?
Okay, so first off, the concept of addiction is a concept that was really popularized by Anslinger, and there's some question as to whether or not there really is such a thing as addiction. And the term addiction is such an effective pejorative term, and very effective in terms of getting budgetary money to have laws and stuff in force, that the definition is a moving target. At one time it was defined fairly narrowly, so it only applied to opiates, and then it was broadened. And the fact of the matter is there is no such thing as cannabis addiction. There certainly can be a specific drug dependency that's associated with that, but there are a couple of clinicians named Henningfield and Benowitz, and there was an article in the New York Times many years ago now where they compared the dependency risk of several different recreational drugs, alcohol, tobacco, coffee, cocaine, and heroin, and cannabis had the least dependency risk. Not that it had no dependency risk, but it had the least dependency risk. And I think one of the things that people miss is trying to deal with cannabis as though it's some kind of mystical substance rather than as a medicine that's been around for 4,000 or 5,000 years, and recognize that the dose that you're getting is important, and you need different doses for different conditions, and that as with most medications, the higher the dose that you take, the more likely you are to have some kind of side effects. One of the nice things about cannabis is that you can take a higher dose of the cannabis under at least two circumstances. One is if you juice the raw plant, because then the cannabinoids are in the acid form, and so you've got this acid moiety sticking out, and the molecule doesn't fit into the CB1 receptor exactly right or exactly completely, so you don't have any euphoria when you juice the raw plant. And then also we know that one of the cannabinoids is called CBD, and the CBD partially fits into the CB1 receptor, so the THC doesn't fit in the same way, and so you don't get as much euphoria, so you can use a higher dose, which you sometimes need to for pain, and you don't have dysphoria, you don't have unpleasant side effects.
What are the therapeutic benefits of cannabis?
Well, because cannabis is important in terms of homeostasis and affects almost every organ system, it's difficult to limit this. Matter of fact, that's one of the problems, is that doctors don't believe that any one substance can have the broad range of therapeutic applications. Obviously, analgesia is one of the top ones, dealing with anxiety, dealing with depression, dealing with seizures, dealing with migraines. One of the things that I've been most impressed with is treatment of autism and autism spectrum disorder. I mean, I've had parents that have just been ecstatic about the results. I think the other thing is neurodegenerative disorder. I have a Parkinson's patient who is a painter, and he's given me several of his paintings, and he said, "Doc, I wouldn't be able to paint if it weren't for you." And I said, "No, you wouldn't be able to paint if it weren't for cannabis, but I'll take the painting anyway." The thing that I found about cannabis is, first off, I've told my wife, I said, I've never felt more like a physician since I've been doing cannabinoid medicine. I mean, we screen everybody that comes in. We don't take kids from the university who say I can't eat and I can't sleep and no, I don't believe in doctors. No, we see people who are sick, who have medical problems, and it's really exciting. And I think the important thing here in New Zealand is to stress doing research, and not research on the low-hanging fruit that's already been done, but research on autism spectrum disorder, research on attention deficit disorder, post-traumatic stress disorder, and especially cancer.
Thank you so much.
Thank you.